Good afternoon. I am going to present paper on choroidal vascular and morphometric changes after intravitreal aflibercept injection in polypoidal choroidal vasculopathy, a retrospective study. Coming to introduction, polypoidal choroidal vasculopathy is one of the commonest exudative maculopathy that we see in our day-to-day practice. It is mainly diagnosis is mainly based on typical clinical findings including reddish orange subretinal nodule and subretinal hemorrhage, and diagnosis can be confirmed by ICGA. In ICGA, we can see branching vascular network of inner choroidal vessels and hyperfluorescence and hypofluorescent halo. Aflibercept is a newer anti-VEGF molecule which act against both VEGFR1 and VEGFR2. Coming to management of PCV. Treatment response of PCV is currently based on demonstration of intraretinal fluid or subretinal fluid reduction on OCT and obliteration of polyps on ICGA. But as ICGA is an invasive procedure, it is not universally available. Recently, new choroidal thickness like subfoveal choroidal thickness and choroidal vascularity index have been described by various authors. Study of the changes in these indices after treatment would be a surrogate for assessing the treatment response. Aim of our study to investigate changes in subfoveal choroidal thickness and choroidal vascularity index after intravitreal aflibercept injection for PCV. Coming to materials and methods, our study was a retrospective study. Study was conducted in a tertiary eye institute in South India. Study period was January 2023 to July 2023. 34 eyes of 33 patients were analyzed in our study. ICGA diagnosed PCV eyes were included in our study. OCT on Heidelberg spectralis spectral domain OCT was used for our study. Loading dose of aflibercept standard dose was given in our study. Choroidal changes like subfoveal choroidal thickness and choroidal vascularity index were analyzed in our study. Now, how to measure subfoveal choroidal thickness? For measuring subfoveal choroidal thickness, using a caliper tool, we have analyzed we have taken the vertical distance from the hyperreflective line of retinal pigment epithelium to the reflective layer of choroidoscleral interface. Now, how to measure choroidal vascularity index? For measuring choroidal vascularity index, we have used a software known as ImageJ software. First, OCT image is exported into ImageJ software. Then we have analyzed using the ImageJ software. We have used an algorithm known as NIBLAC algorithm. Using the NIBLAC algorithm, we obtained an 8-bit image. Then this obtained 8-bit image is a binarized image. In binarized image, we can see black and white areas. Black areas represent the luminal area and the white areas represents the stromal area. Then using the formula, then using the ImageJ software itself, we obtain stromal choroidal area. Then 100 minus stromal choroidal area, we will get the luminal choroidal area. Choroidal vascularity index is actually total luminal area by total choroidal area. Coming to results of our study, majority of the patients in our study were male. Most of the patients in our study belongs to age group of 71 to 80 years. Most of the patients had one-line improvement. In our study, there was a reduction in subfoveal choroidal thickness from 388.9 to 333.1, which was statistically significant. And choroidal vascularity index also showed a reduction from 63.1 to 61.8, which was also statistically significant. When subfoveal choroidal thickness as treatment biomarker, previous reports demonstrated that subfoveal choroidal thickness decreases significantly after intravitreal injections of ranibizumab and aflibercept, while other studies did not find any significant change after bevacizumab and ranibizumab. However, our study found a significant reduction of subfoveal choroidal thickness after 3 months of treatments of aflibercept. Studies have also shown that aflibercept in comparison to ranibizumab decreased choroidal vascularity index better in neovascular AMD. These studies have excluded PCV, but our study found that PCV is also demonstrate reduction in choroidal vascularity index after aflibercept therapy. There is not enough literature in PCVIs treated with aflibercept. Though it was observed that aflibercept was a better agent than ranibizumab in PCV eyes in terms of vision gains and retinal drying, demonstration of choroidal vascular changes have been inadequate in previous studies. Our study demonstrated that aflibercept decreases the choroidal thickness in these pachychoroid eyes by decreasing the dilated choroidal vessels and thereby reducing the intraretinal fluid, subretinal fluid and sub-RP fluid in these patients. When we compare choroidal vascularity index with subfoveal choroidal thickness, choroidal vascularity index is a better parameter because these choroidal vascularity index is not influenced by age, axial length, IOP, and time of day. Coming to conclusion, response to aflibercept in PCVIs could be gauged by non-invasive imaging like change in choroidal thickness and change in choroidal vascularity index. Choroidal thickness in PCVI significantly decreased after intravitreal aflibercept injection. Aflibercept treatment also showed decreased choroidal vascularity index changes. These are my references. Thank you.
Only one injection or multiple injections?
Three injections were given. Monthly 3 injections were given. 3 injections. And 1 month after 3 injection, we were analyzed choroidal vascularity index and subfoveal choroidal thickness.
The method that you used for the choroidal vascularity, is that a validated method?
There is a using the images software. We have analyzed.
Was that your new technique or that has been described already?
This is a newer technique. This images software is used for other binarization of other purposes like. But till now there is no studies available about images software.
You are the first of its kind study.
In using choroidal vascular in OCTA, there is studies available using OCTA, but using OCT, it is the first study. Thanks.